I'm really happy to be here this week. I launched this for the last 2 years virtually, and it's wonderful now to be here in person in a time that we hope is post-COVID. I think as Leonie has just testified to, and I know as many of you in this room know better than anyone, the organ donation really is the most extraordinary gift, a gift of a second chance at life. The improvement in the quality of life for patients obviously is immeasurable, and I think raising awareness of how important organ donation is such an important thing. I'm aware that the pandemic brought a lot of hardships, particularly to those who were immunocompromised. It was a difficult time for the country, but it was even more difficult for those who were most at risk of COVID, and those who were on transplant lists, many seriously immunocompromised. It was a very difficult time, and it was a very difficult time for the organ transplant services, for our healthcare professionals right across the country who were working to support patients. But I really just want to acknowledge the extraordinary work of our healthcare teams all over the country who were working with patients, who were working to continue the services in the most difficult of circumstances, when many parts of our own country shut down to try and keep people safe, when our retail sector shut down and our pubs shut down. At one time our schools, or more than once, our schools shut down. Our health services kept going. They never stopped. And the organ transplant teams never stopped. And I think it was a time of extraordinary resilience and dedication and perseverance from all of our healthcare professionals. And I just want to acknowledge all of them and all of you and the extraordinary work that you've done. Thanks to that, thanks to keeping the services going. Last year we had 250 transplants, which I think is an extraordinary achievement, and I know everyone here today can attest to what every one of those 250 transplants has meant. I want to acknowledge those 250 transplants last year. Those 250 lives came through donations from 86 deceased donors and 33 living donors, and I could never attempt to put it into the words that Leonie has and your family have as to the significance of that for all of you. And at least when you're dealing with the most unthinkable of tragedies yourself, at least it sounds from your own testimony there is some solace in knowing that good people are walking around our country today because of that gift. And I really just want to acknowledge that for everybody who signs up to be an organ donor, and including the living donors who sign up to donate a kidney as well. It is such an extraordinary gift, and I want to thank all of those. I think one of the wonderful exemplars of just how life can change for those who receive a donation was in the World Transplant Games. We had 14 members compete. They had the very difficult task of representing their country and clearly getting themselves into extraordinary shape. We had 4 bronze medals, 6 silver medals, 7 gold medals at the World Games, and I think it's extraordinary. The hospitals involved have each of the hospitals, I think, really just needs to be acknowledged. In Beaumont we had 163 liver transplants just last year. In St. Vincent's 51 liver and 8 pancreas transplants. In the Mater we had 10 heart and 18 lung transplants. In the first quarter of this year, so January, February, March of this year, there have been 81 transplants. And I just want to say that it's the best start to a year that our organ donation service has ever had. I think it's an extraordinary testament to everyone who has helped raise awareness, and to everyone involved in our health services as well. So we've just had the best start to a year we've ever had in Ireland in terms of organ donation. In my role as Minister for Health, I'm very committed to working alongside all of you and our healthcare professionals, the Irish Kidney Association, and all of the other organisations in civil society involved. Essentially, we want organ donation to become the norm. That's our goal. So we've taken a number of measures in government over the last few years during this government. We're bringing in the human tissue bill, as you'll be aware. We've made about 2.5 million available in funding services. I was just asked on the way in to make sure that dialysis services get sorted out in Sligo. The person asking me had promised that she wouldn't, she had promised the people in Sligo she wouldn't ask, and then quite rightly, the first thing she said was make sure that we have proper dialysis services down in Sligo. If I'm coming to a gig like this and I haven't been asked for at least 5 million quid by the time I leave, you're just not trying hard enough. So well done. But the human tissue bill is important. The human tissue bill, I introduced it to the Dáil earlier this year, and I'm very happy to say now we've been working very hard to get it ready for committee stage. And I just checked in with the officials this morning in advance of this meeting here, and I'm very happy to say that it's my intention, to have the human tissue bill at committee stage in the next 4 to 5 weeks. So that's going to be a really important step. I have no doubt that there will be widespread support across politics for the bill. We'll see what sort of amendments are in there. I then want to get it back into the Dáil as quickly as possible through report stage, and then over to the Seanad as quickly as we can. And as you'll all be aware, this is a fundamental change in how we approach organ donation in this country. Essentially, we will be legislating for deemed consent. So essentially, it'll be an opt-out rather than an opt-in service. And our belief and our hope is that this is going to make a very big difference in terms of the number of donors that are available. The other thing we're doing is the National Office of Clinical Audit is undertaking a national potential donor audit development project. We think this is going to help as well. And it is going to help us more thoroughly understand how the current system is functioning. There's a lot of good things happening in the system, but with the best will in the world, it's not perfect. I've spoken with patients, I've spoken with clinicians who are saying, yes, the following things are working. However, we can always make it better. So I think this audit is going to be part of a listening exercise, listening to patients, listening to clinicians, listening to civil society groups, and really trying to identify what can be done better on behalf of patients and on behalf of this service. We've heard today, you've all heard today, from those impacted by organ donation and transplant, by the system we have. The recipients have told about how their lives have changed. We heard from Naomi and about Aaron just now. So can I conclude by saying a few quick things. First of all, I want to thank all of you involved in promoting organ donation. I want to thank all of you involved in supporting patients through organ donation and supporting families on behalf of donors through organ donation as well. It's a very sensitive area. It's such an important area, and it's not easy. It's not always easy. So I really just want to thank everybody for that. I want to thank our healthcare professionals. I think we're going from strength to strength. The fact that there's been more transplants in the last 3 months than ever before in this country is a really good thing. We're going to get the human tissue bill in. We're going to continue to invest in our health services. We're in the middle of the biggest expansion of our public health services in the history of the state in terms of workforce and services and beds. We're going to continue with all of that. We're going to continue investing into these services. We're going to continue investing into patient supports. And we're going to continue working very closely with the quite extraordinary groups, the Irish Kidney Association and the other groups who do so much work, to continue to raise awareness. I'll be using the opportunity in a few weeks' time at committee stage to raise awareness again, and obviously we'll be doing everything that we can this week as well to get the message out there for just how important it is. So thank you again for the invite here today. Thank you for all of the work you're doing, and between us all, I think we're going to continue to make things better and better and better, and save more and more and more lives, and change more and more and more lives. And our ambition, which we will absolutely achieve, is that Ireland is looked at as a country, looked at around the world as a country that is leading in terms of organ donation, opt-out legislation, and critically then the clinical and the social services that need to go with all of that.